well and you make a sentences are very well.
Yeah.
Grammar is not necessary for spoken English, but to make a small sentences, you need a grammar. Where you need a small sentences, I am going, I go, and other sentences. That's a mental health. That's people are think of your job and no job. That's after COVID. After that, we have a mental position. I think grammar is also necessary if you're making a small sentences. If you want to review phrases like phrases or small sentences that are available in our you can understand how you can speak in a small sentences. And small sentences that are very easily to speak and other and most other people they conduct an interview to other person. They use the small you are watching on a YouTube, they conducting an interview 1 hour or 2%. They speak very easy English and they make a sentences very small sentences, not a lengthy sentences. It's my opinion. Madam is also available here and I think they can very good suggestion.
Yeah, thank you.
Yeah, you have to study the grammar. That is the one thing, and the other thing you can watch is the short videos. There you can find these small sentences in Urdu as well as.
Yeah, ma'am, we are so strong in Urdu, in Hindi, and we are basically from Batan family. But whenever I talk with a guy in English and just say something, and whenever just I say something to a guy and just having arguments about a kind of topics or a daily routines, I'm feeling nervous and I can't connect the words to which words or which preposition is match with that kind of thing. But I also work, and I also wanted to say to you that many guys also told me that your English is professionally so strong, but you are simply English that is essential in nowadays life. Whenever you are talking with some guy, that I need this kind of thing, and you work this kind of things, and I will be coming to the 9 o'clock. This kind of English is for me so difficult. And I also wanted to say to you that we will also some arguments here in this group also on the simply English. And there is also one of the English madam from India. She also said that learn simply English is so difficult from the professional. And now we are talking the COVID-19 on the different topic. That type of English is the professionals. And the professional English, when a person can't join the English center, they also spoke easily. But when a guy, they have a lot of information, they have a lot of idea, and they also join classes of speaking, they spoke as better way. But we also require those kind of things. And I really wanted to you also arrange some those kind of things as a debates and is what we can say the dialogues or these kind of things we can learn from those kind of things simply English. And that's will be improvement of me also, and I think many guys will be also can entertain from those kind of things.
Hello. If you don't mind, may I give you some suggestions?
Yes, Shreemans.
No, please, ma'am.
I think through only
Maybe your voice is not clear.
and you can watch kind of videos where a child is saying something and mother is teaching her. Oh.
Ma'am, I think maybe your voice was not clear. I wanted to say, ma'am, I think the best thing that I wanted to say to you. Yeah, ma'am, the big thing is the grammar issue, and I haven't no information about grammars, and I also want to say literally I haven't information about tenses also, that what is the present tense and what is the helping verb and what is the model verb. I haven't no information. What is the do and does and that kind of things. But many guys also suggestion me that you wanted to strong your preposition, strong your English grammar. That will be easy for you. Simply English.
Tayyab, I was saying that definitely you have to practice, and through practice only you will be confident. And otherwise, you can watch the videos, these short videos, where a child is saying something and mother is saying either in Hindi or Urdu. The child is saying something and mother is telling him or her in English, or vice versa. These kind of videos are there on the, I think, YouTube or somewhere, Insta or somewhere. These kind of videos, I have seen many videos I have seen like this. And you can watch it. I think you will grasp very fast with these videos.
Yeah, okay, noted, ma'am. Okay, thank you, ma'am. Inshallah, I want to work on this.
Yeah. I think Shehbaz wanted to say something. Yes,
Shazim. Yeah, thank you, ma'am. I want to say that if someone asks you a little bit, very small sentences like where you go, where you from, then if you don't have good connections and strong English in the simple sentences, then go on for long sentences. If someone says to where did you go, so don't simply say that I am going to city. You can say that, I am from here, and that I feel some of the birthdays.
Yeah, try.
Well, if somebody is asking where are you from or from which city do you belong, then you can simply say the name of the city. If you are hesitant or you are not getting the words, you can simply say the name of that city. Am I audible? I think my voice is clear.
Voice was clear.
Okay. So I think let's come to the topic now. Yeah, today's topic is impact of COVID-19 on mental health. So yes, Tayyab, you wanted to say about it, huh? Tayyab?
Yeah.
Yes, you wanted to say about it.
Yeah, ma'am.
Impact of COVID-19 on
mental health, ma'am. Whenever 2019 there was one virus was found in the China laboratory of the China hospitals, and there's a lot of the broken today also blames on the China that you make this in a laboratory. But there was some people know about them that there's a virus and they came from not made in a laboratory, but this also little bit they came from the, we also want to say that from the Allah taraf. But when there is also difficult for everyone to survive yourselves and also care your family. But many people also pass away from that COVID-19, and there is a lot of mental health problems occurs in this world. But we also wanted to say something about the mental health, that how they can affect on the mental health. Many guys are passed away from the words about the COVID-19 during COVID-19, but and there's a lot of guys that have mental health, that's brain stroke or there is a lot of problem related to the mental. They also have those kind of humors or the cancer or these kind of things also related to face to those kind of guy. But I want to also say something about that. Many people don't worry about COVID-19 at that time, but they worry about that. Whenever a person is coughing or sneezing, they want to say that guy is COVID, and I wanted to not shake hand with this guy. And there is also the rules and regulation. But many people, they also have, we want to say about him the words for nafrat. they nafrat from each other, and they haven't know about the rights of the humans. But there's also the law. I also say to that there is a law and rule and regulations, and they also follow the. We wanted to follow the Islam, but at that time we want to say about the virus. We can't want to work on Islam, not to say that it works on Islam, but we wanted to follow the law also. And that's essential for everyone to work on the mental health. And they also impacts the best thing or the main thing that requires in the COVID-19. They have damage in the mental, and people are just crazy about those kind of things that they works on the body or those kind of things. That is so small thing, and that will be easy for everyone. But whenever they work on the mental, that will be difficult for everyone to survive yourself, to survive your families, and that's also. I wanna further, but I wanna say something about in the last also, but I haven't information now, and give some chance to others. Inshallah, I wanna say.
Oh, thank you, Kaya. Thanks a lot.
Yeah.
Due to COVID, there's many people just lost their jobs. There was a financial crisis also with the many families. So the people came into the depression because of all these things. That people were dying, they are not keeping well, they were having problems, they were mentally, they were having this thing that they are, if they'll touch this thing, they will going to fall ill, or they will, COVID-19 will catch them. So they were isolated, they were inside their houses. So because of all these things, people were depressed. They go on under the depression. I think this was the main thing that people were getting into the depression because of this disease, because of isolation.
And now people are so worried from the depression. They also told the doctor that can you check my depression? I'm also being in a depression. I'm going in depressions and this kind of thing. Little bit nowadays, people are so worried from depression, and they are afraid from the depression.
Yes, still today also people are in depression because they had lost their job and still they are not finding a suitable job for them. So still many people are under depression because of this COVID-19. Whatever the effects were there, so because of that, still people are not able to come up with it.
Yeah.
So, I think this is, yes, Shazib, you wanted to say something?
I wanted to say something, but you know that I am not so comfortable in English language because this is not my mother tongue, and I am not using this language as a friendly way. We use only the English language as a subject, and in our exams, and like the educational English. Only educational English, and we don't use English in colleges and universities because they have a lot of friends here, and they don't want to listen to you in an English language. They are more comfortable in your own mother tongue, own language, or national language. That is in Pakistan is our Urdu. So in our universities, our friends, our colleagues, teachers also conversate to us in our Urdu language. So I am a little bit confused. And I think this is my first time that I am joining this class, and this is also my first time that I am I am speaking in front of 10 to 11 people. But now there are 7, 8. But this is my first time, and sorry for the English if I am wrong. Please correct me. My suggestion, or you can say that. The impact of COVID-19 on a mental health when you are in a when you are surviving in a middle class family, and that type of the gods thing that are happening in your country, and you are from a middle class family, and you have a lot of family crisis, financial crisis. You can't able to survive. You can't able to go for work. The companies also flop, and they turn out their workers, and they, I don't know what to say, but they get out their work.
Yes. Shazim, yes,
Yeah.
continue. What you wanted to say?
I wanted to say that in our surroundings, in our village, there are a lot of people that are going for suicide because they are not able to eat the suitable foods or something like that. Some of the families that have a strong financials, they are supporting. It's not it's the best thing that some of the families are supporting to all of the peoples, but some of the peoples also here in our surroundings that are trying to catch this problem as a as a business. They are trying to ask the people about the COVID-19. Like you can take a simple example that some of the people are selling their own mask in front of their hospitals, in front of their their businesses, and they want to try to sell their products. Some of the businesses are increasing the prices of the products. Like before the COVID-19, we don't use mask. The mask, face masks are normally used in a hospital. I have seen in a TV serials and like in films that the face mask is only uses in a hospital when the surgeon takes the surgery or something like that. And like the nurses when they are dripping something, or they are having their work. So before or after that, there is nothing. But whenever this this COVID-19 comes, after that there are a lot of businesses that have opportunity to make these types of products related to this, and these are fashion, something like that. Some of the families that are, I think that's enough. Sorry for that.
Yeah, they were making these masks, and it has become the family support to them with this business. They were supporting their families with because earlier masks were not there before COVID-19.
Yes, exactly, ma'am.
And of course, the sanitizers also, it has taken the market and ruled the market at that time. The sanitizers and masks.
Yeah.
These were in demand, at that time.
The demand was so in a peak. The demand of masks and the face wash, hand wash and sanitizers and things like that. These businesses are on the peak. They have earned a lot of money from this.
Yeah. But now it's becoming less. I think WHO has said now COVID is finished now. It is not there now. I think I had listened somewhere. I don't know whether it is a true thing or not. But I had listened this thing that COVID-19 is now no more.
Yeah, no more.
Yeah.
It's finished.
It's finished now. But it's a good thing. Otherwise, it was a very a scary thing you can say whenever you are going somewhere or you are touching something. You are feeling that I should not catch this disease. So this was there, and at the back of your mind, it is there that you should not touch this thing, you should not go there, you should not do this, you should not do that. So all these things were going on in your mind, and this was the mind was full of all these things only. Instead of thinking something else, it was thinking all these things only, that you should not do this, you should not go out, you should not touch this. So these were the things which were capturizing your mind, which had captured your mind.
Yes.
Yeah.
And there are a lot of humors are having in our society, that it is the like spy or a sazish. When America and China, the America is trying to beat the Chinese product. They are trying to something like that, and he puts a virus on the China, and then it will growing up, and that will also affect in America. And there are a lot of things. We are in our house. We are occupied. बंद हो गए थे.
You had locked yourself in your house, no?
Yes, ma'am.
Yeah, that was the thing at that time, because nobody was going out, nobody was meeting everybody, no socializing was there. So it affects the mind. It affects the mind because you are not socializing, you are in your house only, you are not talking to anybody. So it affects a lot. Yes, Ruby Kumari.
Yes.
No, thanks for giving me chance.
You're welcome, Ruby.
Ma'am, according to me, and the topic is impact of COVID-19 on mental health. Ma'am, according to me, and when COVID-19 started March 2020, it was started lockdown in our country for the beginning, and which lasted for about 2.5 months. And when for the impact of COVID-19 had a very negative impact on both the mental health and physical health of the people, and people being quarantined for a long time had a negative impact on their mental health, and COVID-19 fear and shorts of losing jobs, and once and loss of job, and had a big impact of people like live and being distracted to going to desired places, and somewhere both family and social infections, and all this was the reasons for the effect on the mental health on the people, and people was very upset about about all these things. That's all.
Yes, Ruby?
And that's all. Yeah.
Okay. Thank you so much, Ruby. Yeah, anybody else? Yes, Ravi Patil has left. So, anybody else wants to say about it? Yes, Shazib, do you want to say still something else about it? Shazib, Tayyab? Nothing? No? This COVID-19 came suddenly in, I think, December 2019. And it makes us scared. No, by, I think, 2020 March, people was not aware much about it. That this kind of a disease is there. Yeah, many of them were known about, many of them were aware of this disease, but many are still there who were not aware of this disease. when the lockdown, the government has imposed the lockdown, and I think all over the world, lockdown was there in 2020 March. Then everybody was shocked about this disease, and they were very scared to touch anything. They make themselves isolated. They were not meeting anybody. They don't want to go out, touch anything. If they were touching anything, they were using sanitizers. They were washing their hands. So mentally, they become sick because of this disease. That this disease should not catch them. Because of that, there was so much of thinking. They were thinking so much that they made it a pressure on their mind, and they had lost their jobs. Many of them has lost their jobs. And in the middle class family, there were many problems because of these jobs and all. So, and there was in 2021 they had seen so many. We all had seen so many deaths in 2021. So it also affected our mind that so many people are going because of this disease, and people either they are taking less dose of this treatment, or they are taking higher dose of this treatment, and because of that, as a result, people were dying. So this was the thing, and because of all these scenarios, everything what has happened from 2019 till 2021 end, or you can say 2022 beginning, you can say in 2022, people were depressed. And still people are searching their jobs, financial conditions are not too good, still the financial conditions are not good. So people are depressed because of financial conditions also, because of this disease also. So I think this is the major effect that people gone into the depression. Yes, anybody else wanted to say about it? No one?
Yes, ma'am, I want to say something, but this is not related to the topic.
Okay, fine. Yes.
This is my, I have already told you that this is my first class, and I really enjoyed it. So, is there any other classes, or how may I know that the class was starting?
We are having a WhatsApp group. So you can join our WhatsApp group, and with that WhatsApp group, all the information you will get about this class. So we are doing this class from 9:30 to 10:30 from Monday to Friday, from the Indian Standard Time. According to Indian Standard Time, we are doing this. So wherever you are, you can calculate according to that.
Okay.
So link will be displayed on the screen, so you can join with that.
Okay, ma'am.
Anything else? Yeah, Ravi Patil has joined now. I think Ravi Patil will surely say about the topic.
Madam, I talk after 15 minutes, please.
Okay. Yeah, Mohammad Khalid, will you say about the topic?
Hi, Assalamualaikum. Hello. Hello.
Hello, yes, Mohammad Khalid.
I'm from Myanmar.
You are from?
Myanmar.
Myanmar. Okay, fine. Yes. You wanted to say about the topic?
Until now.
What do you want to say about this topic? It's a common topic, the COVID-19, the effect
I want to present
effect.
this type of topic.
In Myanmar, there was the COVID, right? There was also some people were affected with the COVID.
Any kind of topic, no problem.